One of the reasons we developed Exemplar was that we realised that there is unwarranted variation across our organisation, and we didn't understand it.
Hi there.
Prior to the Exemplar Ward, we were delivering good care. Unfortunately, we weren't always able to evidence that in the way that we would have liked to have done.
Hi, Shirley.
We got together a group of healthcare professionals and patients, and we asked a simple question: when a ward's flourishing, what does that look like? And from there we came up with our 5 standards of an exemplar ward, underneath which are 12 fundamental objectives, and ultimately distilled that down to 72 measures that tell us how well the ward's performing.
Focusing on the 5 key pillars that we've laid down within the exemplar ward are, I believe, absolutely key. Patient experience, patient safety, staff experience, efficiency, and for us, innovation and learning from really good practices, and not just telling people off when things aren't going right.
Moving from reacting to data to being much more proactive and looking at data in the round was really one of the key principles that we were starting from. And one of the ways we've managed to get people to think more proactively about their data is bringing it all together in one place.
The main change for me is that in terms of looking at quality metrics, we would look at them on a month-by-month basis, often in terms of exception reporting, so kind of only looking at what was bad in terms of that month and not really looking at them in terms of trends. And so this programme really has brought all of that information together. We now get a monthly ward report, and it really allows us to scrutinise what it is that we're doing well, what it is that we clearly need to change.
We have taken a complete change as a culture within the organisation to recognise that just because things aren't where they need to be, that doesn't mean to say people are failing. This is about making ongoing improvements and making sure that we use data to help us to drive efficiency and drive innovation and drive improvements.
The nurse leadership role is fundamental to the Exemplar programme.
My role in the Exemplar Ward implementation as a ward sister is to lead quality improvement initiatives on my ward. In the thoracic ward, where we introduced the huddle at 3 o'clock, we have improved the patient safety because we are able to identify why there is deviation from the care plan that was set in the morning.
Enabling the team to understand that this is a feasible and sustainable project which will make a big difference towards patient and staff experience, and therefore it's very important to get them involved into the project to get the success.
If you really do want to add value, you need to understand where you're at. And the way that they receive their data packs lets them really understand the normal variation in their data for their area, so it really stops that urge to jump on those reds on a scorecard, because they understand our processes are okay, this is to be expected, so they know when they need to react to data.
I think it's absolutely strengthened the role of the ward sisters, charge nurses, the matron's role. They're all involved in this, whether it's been designing the metrics, whether it's been about helping to identify the way that our panels and our assessment programmes run, whether it's been about contributing about what hasn't worked as well as what has worked.
Or you just self-managing with the GP?
We've got 21 improvement projects that our wards own. They are their projects. They are not things that we've asked them to do. They are things that they want to spend time and attention improving against.